Hey everybody, this is Sammy C. We're calling.
Pulmonary sleep and allergy consultant. This is Chatty. How can I help you?
Yes, ma'am. My name is Sammy Carrejo. I was wondering if Dr. Asad was available.
He's not actually, sir. We're not sure when he's gonna be back in office.
Okay, is he still seeing patients? Is he here in El Paso or is he out of town?
He no, he's in El Paso. It's just that they're requiring him for him to be at the hospitals at this time. So he hasn't given us a set date as in when he'll be back.
Oh, okay. Well, that's kind of the reason why I'm calling, because I know he is out, and so are many doctors who are, I guess, taking care of patients in hallways. Is that correct?
I'm not sure.
Oh, well, no, I'm just. I know. You're kind of giggling. That's what it said on the newspaper, so I'm kind of concerned. And I do have a friend who has a mother in the hospital, and I know due to HIPAA
Okay.
regulations, you really can't talk about this patient. But this is one of Dr. Omar's patients. Uh,
Mm-hmm.
but let
I
me.
mean, if she's in the hospital, they can request a consultation with him at the hospital. But as far as in the office, it's we're kind of just waiting to see
Oh yeah,
when
yeah. I,
he'll
I
be
hear you.
back.
That yeah. So that's kind of why I'm calling because she has a family member who's concerned, and obviously with all the stuff that's all over the news, it's just making it seem like people are dying left and right. And so I'm trying to keep her calm, you know. But unfortunately, everything that's being reported on the news this just has everybody scared. But let me ask you
Yeah.
this: is Doctor Omar giving any of his patients any medications to try to save lives, or is he just putting them on ventilators?
At the hospital or
Yes,
here?
ma'am. Yeah, at the
Where?
hospital.
I'm sorry.
At the hospital.
I'm not sure. We have no information about patients in hospitals and who and what patients he's treating or how he's treating them.
Right. Plus, HIPAA regulations wouldn't allow you to say that to me anyway. So, um, is there anybody there at the office who might be able to at least give me some general information about
If it has anything to be related with the hospital, no.
okay, is anybody there who works for him, maybe a nurse practitioner or a head nurse there available
No.
for me to speak with?
No.
Nobody's there. Has he
No.
shut down
Just the
his
staff.
just his staff?
Yes.
And when you mean staff, you mean just front office,
Correct.
coders and stuff like that. No medical people there.
No.
None whatsoever. Wow. Okay. And the reason for my call is I'm trying to figure out why these doctors are just putting ventilators and not using medication that has been approved by the state of Texas. And so I wanted to see where Dr. Omar was because I keep getting different answers from different doctors. And I myself just came from Austin on October 3rd. And I know doctors are allowed to give medications, but there's a lot of doctors who are still not doing it. So I just kind of wanted to see if Dr. Omar was one of them because my friend's mother is in the hospital, and the chances of her surviving are not great. Just because she's in the hospital. Um, is there any other way I can get a hold of the doctor, or what would you recommend for me to do to try to help my friend out here with her mother?
I mean, at this point, like I said, we're only sending out any text messages for consultations that are being called in for him. Other than that, we're not having any type of communication. Um, I mean, the only other thing, if she is a patient of the doctor, that's the only option at this point for her to ask for a consultation with the doctor.
You mean the
Um,
doctor, the patient that's incubated right now?
I'm not sure.
No, 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 no. That wasn't a
If
question. I'm asking you because you said if she is a patient to ask for a consultation, but she's inside the hospital and she's got a tube down her throat. She's in a medical coma. How can she ask for a consultation?
Okay, so well, I don't know in what situation the patient is, or
Yeah,
I'm
yeah. I'm
not
not
sure
asking you.
who.
I'm telling you. That way you can kind of better make a decision. We're not talking generalities. We're not talking in normal cases. We're talking about this case. And in this case, this patient cannot speak. So, what is the protocol?
Does the patient have family members where they can call?
Yes, and the reason why I'm asking is because she's not getting any help or anything, and her mom's possibly on her deathbed, and she can't get any answers. So that's why I'm calling. Forgive me if I seem rude or persistent,
Yes, I know her.
but yeah, I know, and unfortunately, that's what it takes to get answers. Because my friend is possibly losing her mother, and this I don't know, or this in most cases is not really helpful. So I'm gonna let her know.
But your friend wants to call the office, since it is her mother, we can maybe help her a little bit more since you're not a family member.
Right, yeah, I'm just a nobody. So what is your name so I can have her call you?
It will be Chari.
Chai?
Chari.
Chadi. Okay. Chadi. So
Yeah.
I will call her right now, let her know that I spoke with you. And I need you to just walk her through it because she keeps getting I don't knows and not right nows. And that's kind of, doesn't do very well. She was actually on Channel 26. They interviewed her, and it's pretty sad. And she's crying and she's saying, you know what, nobody wants to talk to me, not even my friends, because she had COVID. So she's in a really bad situation. And I hate the fact that I have to be a little bit of a jerk to try to get her help. But unfortunately, that's kind of what you got to do sometimes. So, Chadi, I'll have her call you right now. And please do me a favor. Just help her. Try to help her get some information so we can see what we can do with her mom, okay?